Ian here, and the topic now is how does TMJ and craniofacial or orofacial pain and dental orthopedics relate to each other. The human body was designed to work in relative harmony and balance, and in a perfect situation this is exactly what it does. I like to think of it as like the wheels on a car, and it was designed to work in harmony. But if the wheel alignment is not perfect, then all sorts of problems can occur, ranging from a mild running off of the tires on one side to severe wobbling of the tires being very dangerous. You know, the jaw joint is way more complex than the wheel system in a car, but the principle is the same. So we think of bone as a rigid structure, but it's not. And it can adapt to the forces being applied. And this phenomenon is known as Wolff's Law, where the forces applied to bone has effect on the size, the structure, and even the density of it. So I can give an example and say that the top jaw doesn't grow to its rightful size due to some factor. Say for instance like mouth breathing. Now with the smaller upper jaw, in most cases this will have a restrictive effect on the lower jaw by the way the teeth are now meeting. So if the top jaw is too small, the lower jaw will be restricted. Now this backward pressure of this restriction on the lower jaw can literally change the shape of the jaw joint or the condyle just where it goes and forms part of the jaw joint. And that is right on the most top part of that jaw joint. So with backward pressure it can literally change the shape of the jaw condyle, and that has a massive effect on the way it functions. Wolff's Law applies, but also Newton's third law. For every force is equal and opposite. So if the jaw is restricted and is forced back, then it's forward force onto this jaw joint condyle, and that will have a long-term effect on the shape and the function of that condyle. Now the condyle, like I said, is a very complex joint, and the condyle, to function, it first rotates. So as the jaw opens, it rotates, and then it translates. So the first opening, it turns around its own axis, and then it moves down and slides down this eminence, this glide path that it has to function with. So it's opening a little bit and then opening a lot. Now if this shape of the condyle has changed and it's now that shape, so this axis of it being able to function quite normally there has now changed. So that axis, when it turns, this back part literally goes up and is more likely to hit some other structures back here. So the rotation is limited. So it has to either move into translation earlier than it was supposed to, or it has to kind of jump free of the articulation fossa. And normally that's where when we feel an opening that one of the jaws will literally pop out to the side, the jaw joints will pop out to the side, and then the movement starts happening like that. So it's first this kind of a S movement for this to come free, and it's mostly because of the restriction of that rotation along the axis of the condyle. And in these kind of cases, splints, exercises and relaxation just won't cut the mustard, and the shape and size of the bone needs to be changed. So this is where repositioning splints and dental orthopedics and orthodontics come into play. So if we reposition the top jaw forward without the need of surgery, then the lower jaw is allowed to reposition further forward, and over time the shape of the condyle can improve and allow for more harmonious movement and long-term stability. And this is just one example of dental orthopedics being effective in jaw problems. There's a few others, and these include one-sided crossbite, where the jaw is positioned further over to one side to allow for proper functioning of the teeth. Upper and lower jaw cants, where the level of the teeth are relevant to the eyes, are off kilter. So the eyes are supposed to be horizontal and the teeth are supposed to be horizontal as well. And if that changes, it changes the shapes and the forces on the jaw joint as well. Midline discrepancies, where the teeth are literally over to one side, and it could be both to one side or either combination of this side or that. Adenoid face, resulting in a vertical facial growth, where mouth breathing has resulted in the shape of the jaws literally changing, and that will have an effect on the jaw joint as well. So these are a few examples of how dental orthopedics can have an influence on the jaw joint and the pain thereof. Thank you for listening.